All right, let's get into it. We take medicines all the time to feel better. But what happens after we swallow that pill is this hidden, incredibly complex, and honestly, just a fascinating journey. So today, we're going to follow that journey, step by incredible step.
I mean, it seems pretty simple, right? You take a pill and hopefully it does its thing. But how does it know where to go? How does it even get there? And then how does your body clean it all up afterwards? That's the amazing story we're unpacking right now.
Okay, so this right here is our mission map. Think of a medicine's journey like a secret agent on an operation. First up is absorption. The agent's got to get into the country. Then comes distribution. It has to travel to the target. After that, biotransformation. It might need to put on a disguise. And finally, excretion. It's got to make a clean getaway.
And of course, there's a pretty cool scientific name for this entire process, pharmacokinetics. It's basically the study of what our body does to a drug, and it's the whole reason medicine either works or it doesn't.
So let's kick things off with stage 1, absorption. The very first challenge for any medicine you swallow is to breach the walls of your gut just to get into your bloodstream. And trust me, it's not nearly as easy as it sounds. The drug's first major obstacle is this thing right here, the cell membrane. You can think of it like a bouncer at a super exclusive club. It's this fatty lipid layer with some protein channels in it, and it is very picky about who it lets through.
So how in the world does our drug get past this gatekeeper? Well, it turns out it has a few different tricks up its sleeve.
The easiest way in is if the drug is lipid-soluble or, fat-loving. It's like that old saying, like dissolves like. These drugs can basically just melt right through that fatty cell membrane, moving from a crowded area to a less crowded one. No energy needed, just a smooth entry.
But here's the thing. A lot of drugs aren't fat-soluble. They're more like guests who aren't on the list. They can't just stroll in. They need a special escort to get them past the bouncer.
And this is where it gets really clever. Some drugs get an escort through something called facilitated diffusion. A special protein grabs them and just kind of helps them across the membrane. Again, no energy needed. But others need a full-on powered lift, which we call active transport. This process uses the cell's own energy to literally pump the drug inside, even if it's already more crowded on the inside.
Now get this, what's really wild is that this journey isn't always just a one-way street. Sometimes a drug can cross that membrane, and then it can actually get stuck.
Yeah, it's a really cool phenomenon called pH trapping. So a drug can sneak across the membrane when it doesn't have an electrical charge. But if the pH inside the cell is different, the drug can suddenly gain a charge. And once it's charged, it can't cross back over that fatty membrane. It's effectively trapped right where it needs to be. Pretty smart, huh?
Okay, so our drug made it past the gatekeeper. It's in the bloodstream. Now it's on to stage 2, distribution. It's time to hit the massive superhighway of our circulatory system to find its target.
If we look back at our mission map, there's a really important detail here. As soon as the drug hits the blood, a lot of it immediately gets grabbed by proteins. This bound drug is inactive. It's kind of like being put in handcuffs. Only the free drug, the part that's not tied up, can actually leave the bloodstream and do its job.
And some targets are way harder to reach than others. Our normal blood vessels are a little bit leaky, which is great for letting drugs out. But the blood vessels in the brain, they have these super tight junctions. This is the famous blood-brain barrier. It's like a high-security fortress that only very specific, usually super fat-soluble drugs can even think about getting through.
So, our drug has reached its target, it's done its job, but the mission isn't over yet. Nope. Now it's time for stage 3, the transformation, or as scientists call it, biotransformation.
The headquarters for this whole makeover operation is the liver. It's a total processing center. In here, powerful enzymes chemically change the drug, breaking it down into new substances called metabolites. The main goal here is usually to make the drug more water-soluble, which is just a fancy way of saying it's getting it ready to be flushed out of the body.
And that leads us right into the final act of our medicine's epic journey. Stage 4, the Great Escape, also known as excretion. The body needs to clean up and get the drug and all its new metabolites out of the system. And it turns out there are a few different exit routes. The most common way out, by far, is through the kidneys and into our urine. But drugs can also be eliminated through bile, which ends up in feces and even in really tiny amounts through our sweat and saliva. And with that, the mission is finally complete.
So, we followed this entire 4-stage journey, from start to finish.
But why does any of this actually matter? Well, because every single one of these steps dictates whether or not a medicine is going to help you feel better. And really, it all comes down to a graph like this. See, for a drug to work, its concentration in your blood has to get above that dotted line, the therapeutic concentration. But it can't go so high that it becomes toxic. That whole four-part journey we just walked through is what shapes this curve. And this is exactly why that journey is so critical. For example, a fast-acting painkiller you take for a headache. That might follow the green curve. It gets in fast, hits a high peak, and gets out quickly. But a medicine for a chronic condition, like high blood pressure, you'd want that to follow the red curve. A slower absorption, a lower peak, but it stays in that effective sweet spot for much longer. It's all about designing the journey to create the right effect.
So, the next time you take a simple pill, just take a second to remember the incredible journey it's about to go on, breaching barriers, navigating highways, undergoing a complete transformation, and making a final, clean exit. It's truly a hidden marvel of biology, and it's happening inside you right now.